I'm Cheung, a medical doctor. This is a short video on palpating for trigger points in the lower back region. Palpating for common trigger points in the lower back region. Trigger points are tender, palpable nodules or cords in a muscle or a ligament. When compressed, are very tender and can give rise to referred pain. Trigger points in the gluteal muscles, the piriformis, can cause pain locally and radiating down the leg, mimicking other conditions. Trigger points are very common in any pain syndromes. They can be the sole or part of the causes of the pain. It is very useful to eradicate them in any pain syndromes. Trigger points can be caused by, number one, trauma. For example, a fall, a misstep. Number two, repetitive strain. For example, poor walking dynamics from a persisting plantar heel pain or a severe knee pain. Number three, constant contraction or activation of a muscle in order to guard and protect a nearby painful structure. For example, constant contraction of several lumbar muscles to protect a hip pain or a greater trochanteric bursitis pain. The position to palpate for trigger points in the lower back region. To palpate the lower back, we can't really do it with the patient sitting or standing. The patient has to be lying in a prone position with the lower back and thigh area uncovered. I usually tuck a towel underneath the elastic of the underpants. That way I can move the towel up and down without the towel dropping away. To palpate, I usually apply some soluble bath oil or massage oil for better sensitivity. And my palpating hand, 4 fingertips in line for better coverage. The lower back muscles are very thick structures. I usually have overlapping hands and putting my body weight behind them in a rocking motion to palpate so that I don't strain my own arms. We have here the pelvic rim, the sacrum, posterior superior iliac spine, and the greater trochanter here. The quadratus lumborum arises from L1 to L4 transverse processes and the 12th rib down to the ilium. We can palpate for trigger points in this muscle like this. The gluteus maximus, arising from the ilium, the sacrum, and the coccyx, right across to the iliotibial band and the femur. A big wide muscles. It's quite thick. It can be as thick as 3 centimeters. Then we can palpate for trigger points of the gluteus maximus like that. There is a very important line here called the piriformis line. It goes from the posterior inferior iliac spine to the greater trochanter, the upper pole of the greater trochanter. I'll mark it. This is the piriformis line. Above the piriformis line is the gluteus medius, and underneath it, the gluteus minimus. They both arise from the ilium to the greater trochanter. Now below this line is the piriformis muscle. It arises from the anterior aspects of the sacrum and going to the top pole of the greater trochanter. So in order to palpate the gluteus medius and minimus, we do this. Trigger point in these two muscles are very common in any lower back pain. And to palpate for the piriformis, we palpate like this for them. Trigger points in the gluteal muscles, piriformis, and quadratus lumborum can cause pain in the lumbar, gluteal, and sacroiliac area. Trigger points in the gluteal muscles and piriformis can also cause pain radiating down the leg, often mimicking other lower back conditions. Now looking at the lateral hip area, we have the greater trochanter. A lot of muscles are attached to it, so there can be a lot of trigger points around it, and we can palpate all around it carefully. Now just in front and above the greater trochanter is a tensor fasciculata, arising from the anterior iliac crest and the anterior superior iliac spine going down, and we can palpate that muscle like that. Now lying prone, we can look at the muscles on the posterior thigh region. From the ischiotuberosity, marked here, we have the hamstring. On the lateral aspect, we have the bicep femoris. On the medial aspect, we have the semitendinosus and semimembranosus. And on the lateral thigh, we have the iliotibial band. And all these are very thick structures. To palpate, I like to use the heel of my hands, like this way, and with oil on top, and putting my body weight behind my palpating hands, looking for trigger points this way. Now, trigger points in the hamstring and the iliotibial band are often associated with mechanical lower back pains, and they need to be treated in order to treat lower back pain. This is a schematic diagram of all the common trigger points in the lower back region. We should consider including trigger point palpation in our examination protocol. With practice, it can be done in a few minutes. Having found the trigger points in a patient that may be causing the pain, there are many modalities of treatment. Personally, I have found YNSA, Yamamoto New Scalp Acupuncture, to be highly effective. The treatment using YNSA can be viewed in another video.